Hello, everyone, and welcome back to the second session of SEPA for transgender women. As you remember, this SEPA session is going to be about the information that we will be presenting. It is not intended to teach new information, but it's just to give you an idea of the information that will be presented. This is session 2, which is called HIV, ABCs, PrEP, PEP, and U equals U. So just a little reminder, what is SEPA? SEPA stands for Health, Education, Prevention, and Self-Care. And it's an intervention designed for, was originally designed for Hispanic women, and now we are using and testing this intervention for transgender women. As in session 1, we would go over the group rules here and ask if there are any other commitments that participants would like to agree to adhere to in the group process. The same thing here, we would ask them to reaffirm their confidentiality, that what is discussed in this group would stay within this group. At this point, we would give time to discuss the homework from last week. If you remember from the first session, this was the homework assignment that they were asked to create, and we would generate discussion around this homework assignment. Again, we're not doing it in this session because this is just showing you what we would be teaching and not actually going through the exercises. Okay. Now, also, we would have in this session, we would have an activity on myths and rumors about HIV and AIDS. And we would ask the participants to respond true or false to each of these questions, kind of in a group setting. So I'll go through each of these questions here. And as you can see from the first slide, the answers provided in these slides, but we would not have the answer provided for these women. So for example, we would ask them the first question: you can always know if a person has HIV and AIDS on site, true or false? And of course that is false. And then the answer, the rationale for the answer is included below. The second question, it's important to know your status, which is true, and the rationale is also included below. The next question, if you have more than one sexual partner, you will not contract HIV, and that's false. I'm sorry, if you only have one sexual partner, you will not contract HIV, and that's false because we know that many people can get infected from, just one partner, can get HIV from just one partner. So that question is false. The next question is, only men who have sex with men are at risk for acquiring HIV, and obviously that's false. Anybody who's having unprotected sex can get HIV. And a lot of people, we love this question because a lot of people seem to believe that this question is true. Really old information, but they still kind of believe that it's true. Okay. Women are at a lower risk of acquiring HIV. That's false. We know that women are just as susceptible to men as men, and most women get HIV from their male partner. Women come with also some vulnerability from social and psychological issues. And of course, if you remember from session 1, transgender women are more vulnerable to HIV also. So that's always an interesting question to discuss. People living with HIV look and feel sick. Of course, that's false. A person living with HIV who's well controlled can look and appear very, very healthy. And then here's another question that we would pose to the women. Pre-exposure prophylaxis, or PrEP, is a medicine to prevent HIV. And here we would give them an option of true, false, or don't know, because some women may not know about PrEP. The answer is that is true, and we will tell them that we'll be discussing PrEP in this session. Doxy post-exposure prophylaxis, or doxy-PEP, is a medicine to prevent STIs, sexually transmitted infections. Here we would do true, false, or do not know. And it's true. And again, doxy-PEP will be discussed in this session. Okay, so we're going to get into some of the, not only HIV, but some of the sexually transmitted infections and why are STIs important in HIV prevention. Okay, and so, you know, a little bit of review information here. How do people get sexually transmitted infections? And if you notice, we're going to use the abbreviation STI for this. Mostly you get it through sexual contact. You could also get it from drug or needle sharing, and that includes the needle sharing with sharing of needles to inject hormones, and then definitely mother to child transmission. Okay, and there's a little note there that often it takes a little bit of time for once you've been infected with an STI to show some symptoms, sometimes up to 2 weeks, sometimes a little longer, and they're not transmitted by sharing underwear or using public restrooms, okay? And we'll talk about specific STIs in a second, all right? Some of the things that we want women to know, STI facts. Why are we including STI information in HIV prevention? Well, if you have an STI, it increases the risk of getting other STIs, including HIV, all right? We know that children can become infected with an STI if the mom has one during pregnancy, childbirth, or breastfeeding, okay? We know that a lot of people acquire sexually transmitted infections through sexual abuse, especially children and minors and young adults. But the most important information that we want to give you here is that STIs can be prevented. Okay, so now we're going to talk about what are some of the most common. And again, this list is not all encompassing. So please don't think, you know, just because we left one out, it doesn't mean that it's not important. It is important, okay, but you know, this is the, you know, the most common ones that we're going to go through here with you. Okay, chlamydia is one of the most common sexually transmitted diseases. Again, it's sexually acquired. And you can see here that people can get it in the eyes. You could notice this guy has a very red eye with like discharge coming from it. If you would have any discharge in the second picture with the fingers, if you would have any discharge from, you know, any area, this is what the discharge would look like. It would be white and very sticky. And you can see there the picture with the fingers, with the people pulling the fingers apart, and you see that it's still attached. It shows you that it's a very white, sticky infection. And you can see here the third picture of a penis. You can see some discharge coming out of that penis. And if you took that discharge and put that on your fingers, you would notice that it was very stringy like that. And then the fourth picture, I'm sorry, shows what a healthcare provider would see if they opened up, you know, the area using the vaginal area using a speculum. And you can see that area that's all white there. That's the area that's infected with chlamydia. And that area is what we call the cervix. And that cervix would be usually nice and pink in color, kind of like the rest of the surrounding tissue, but you see because it's infected, it's milky white and it's got the red inflammation areas there. So that's chlamydia. And again, that's sexually transmitted. Gonorrhea, you can see here from this person's penis that the gonorrhea here looks a little bit like chlamydia, but the difference with gonorrhea is there's a lot more discharge, and sometimes the discharge tends to be yellowish or greenish. Again, another sexually transmitted infection um, acquired through having sex with somebody who has gonorrhea. And this infection, will continue to cause a lot of discharge from the penis area here, and also from the vagina, if it's in the vagina, or from the rectum, if it's in the rectum. And it will be very painful, especially when they urinate. Okay. Syphilis, which I just heard from somebody from the health department yesterday, that syphilis is on the rise in Miami-Dade County. And you can see here what syphilis looks like in the vaginal area, in the penis, and on the palms of the hands. And you get this like red rash at the point of contact from having sex with somebody who has syphilis. And then later on, you get these um, spots on your hands and on your feet later on. And that's usually the primary and secondary stages of syphilis. Okay. And you can see here, this person has very significant ulcers on the penis and kind of in the groin area for the male picture. And then in the other one, in the vaginal area, you can see when the vagina is open, you can see that little red spot where the infection has taken place, and that's called a chancre. And that's where syphilis has infected that person. Okay. We have genital herpes, okay, which are like these little blisters that you can get on your vaginal area. Here you can see um, the area of as the vagina is spread open, you can see these little blister-like things. And then on the penis, you can also see um, these little blister areas. And this is different than the little cold sores that you get on the mouth. But however, remember, if you're putting your mouth in this in on either one of these areas and a person has an outbreak of genital herpes, then you will get that herpes infection. That genital herpes will also go to your mouth. Okay. And then probably one of the most painful looking sexually transmitted infections are these genital warts, which are called condylomas. And they, as you can see, this penis looks like it has like sharp edges from the warts. And then you can see here on the the second picture, which is the vaginal area, it looks like it's completely covered over. These can be painless or they can be painful. And the only way to get rid of these is to have these surgically removed. The other ones that I presented can be treated with antibiotics, either by mouth or an injection. But this one has to be treated surgically to remove these, and with medications. Okay, so now that we've talked about sexually transmitted infections and we've seen those horrible areas, or those horrible pictures of those areas that can get affected by sexually transmitted infections, let's talk about ways that we can prevent HIV and sexually transmitted infections. Now, you saw this in the first lecture, the first session, where we talked about the ABCs, which we consider behavioral prevention, and then our biomedical options. Okay. And our behavior, we have three, we call them ABCs. A being A for abstinence. All right. That means you don't have sex with anyone. And again, we know this is not an option, but it is a part of HIV prevention. So we do have to present the information. The B stands for be faithful, which is mutual fidelity with your partner. And the C is the correct and consistent use of condoms, male or female condoms. Okay. Now, if we add that with biomedical prevention options, we can prevent HIV through the use of PrEP, which we'll talk about in a little bit more depth. All right. And we can prevent sexually transmitted infections using doxypep. And we can also prevent, for people who are living with HIV, we can prevent those people from passing HIV through their partners through what we call U equals U, which we'll also talk about briefly. Okay, so what makes HIV prevention difficult for trans women? And here's just some what the literature tells us, that male partners don't want to use condoms. There's social pressure, and transphobia, prejudice against transgender people that makes HIV prevention difficult. It's hard to reach transgender women sometimes to get them enrolled in this. Most people, including transgender women, have more than one sexual partner in your lifetime. So when you have more than one sexual partner, that definitely increases your risk. The earlier you initiate sexual activity or your first sexual experience, the more sexual partners you can have, and the more likely that you can contract HIV if you're not practicing safer sex. We talked about drugs and alcohol in session 1. We'll talk a little bit more about them in the next session. And of course, survival sex work makes HIV prevention difficult, because if you're relying on survival sex work for income, you're having more than one sexual partner. And of course, we know that increases your risk. All right. So no judgment here, but it's just that we recognize that HIV prevention is difficult for the general population, and it's also very difficult for transgender women. Okay, so one of the difficulties that we know about is getting people to use condoms. And here you can say people don't want to use condoms because of intimacy, right? It decreases the intimacy between partners. It decreases the confidence, right? Like if I ask someone to use a condom, it means I don't trust them, or they're going to be asking me what I've been up to because I want them to use a condom. All right. And also the third thing is the convenience. It's much more convenient and easier to have sex without condoms. So these are kind of some of the excuses that people use for not using condoms, right? Continuing on, sensation doesn't feel as good with a condom. All right. Frustration, people are getting tired of it. They're getting like condom fatigue. You hear that term sometimes. People get tired of using condoms, right? The partner doesn't want to use a condom and sometimes pressures the other person not to use a condom, right? This kind of like fatalism of like love and destiny, if my partner has HIV and they die, then I want to die also. Or the destiny option of, oh, well, we're all going to die of something. So maybe, this is what I'm supposed to die of. All right. So kind of some things that people have said that, kind of keep them from using condoms. So now we would get out of that heavy material and do some myths about condom use. And again, it's true or false. And again, we would encourage participation here, getting the person to answer true or false. And then we would definitely correct the information going through there. And you can see, again, we include the answers here, but we wouldn't be including these until the person or the group would answer the question. All right, first myth, condoms break fairly frequently, and that's false. They're very, very strong. All right, but if you're using the wrong lubricant, it can definitely make the condom break. And it's important here to note that condom breakage is different from like the condom slipping off. All right, that sometimes does happen. That's different from breakage. All right. Condoms should be placed on immediately before the man comes. All right. And that's false because, you should place it on right before, you initiate sex, because sometimes men get aroused and they start releasing pre-ejaculate or pre-cum. And if you're not putting on a condom before the man comes, then you're not getting the HIV prevention that a condom offers you. All right. It's better to use two condoms. That's definitely false. And that's one time when a condom may break because of the friction between the two condoms. And I would even argue here that if you're using two condoms, nobody feels probably anything but the condom. So that's probably not a good idea. I can't use condoms because I'm allergic to latex. A lot of people say this, but there are other options, like there's polyurethane condoms, right? Now there's also lambskin condoms, but they don't protect against HIV or STIs. So this would be important information that we would want to make sure that the women understood, right? So we know that condoms are highly effective in preventing HIV and other STIs. So, it's very important that you learn to use, that these women would use to learn to use both male and female condoms. And also the very important part of anytime you're using any type of a condom, you have to use extra lubricants, water-based or silicone-based, because it will prevent the condom from tearing or breaking, or coming off if it's not sufficiently lubricated. Okay. So here is where we would show, during the live session or the Zoom session, whatever, we would show male condoms. All right. And which probably everybody's familiar with, but we would show those. And we would also show, not only from this little picture here, but we would show how to correctly apply a male condom using a little wooden penis with an actual condom. Okay. And we would actually demonstrate that. And then we would definitely demonstrate how to take the condom off after it's done. And we would have a couple of these wooden penises, and we would allow, if this were a live session, we would, give out the wooden penises to the participants and have them practice putting on a condom, and taking off a condom, with everyone else watching and helping them learn this condom skill. Okay. We would also talk about the female condom. Okay. And again, we would have a few of these available, these female condoms, and we would show the size of the female condom relative to the male condom. Okay. And then we would also show how to insert a female condom, using a demonstrator there. So it's important, it would be important for women to get information on both. Okay. So those are condoms. So now we want to talk about our biomedical option. And the first one we want to talk about is pre-exposure prophylaxis, or PrEP. Okay. And this is one pill once a day to help reduce the risk of getting HIV. Okay. And this is for people who do not have HIV. All right. People with HIV cannot take this medication. All right. Although this medication may be a part of the medications that people with HIV already take. but this is for people who are not living with HIV, okay? And so PrEP is, is prescribed by a healthcare provider, and you have to test HIV negative before you get PrEP. And then you get also some blood work to make sure your liver and kidneys are functioning properly. And then you have to be monitored every 3 months for your liver and kidney functions, but also to make sure that you haven't gotten HIV when you're on PrEP. Okay. Very important things is that PrEP is about 99% effective when taken correctly for people to prevent HIV. And even with people who inject drugs, which is a much higher risk of contracting HIV than sex, it reduces their risk by about 70%. So that's kind of interesting. Again, having lived through the 1980s and seen the HIV epidemic up front, it's just incredible that we have this medical option, this biomedical option that helps people prevent HIV. And of course, when you're using PrEP, you're also supposed to be using condoms, but we know that typically if people are using PrEP, they're probably not using condoms. Okay. And the approved drugs are Truvada and Descovy that are given by mouth. And there's another drug called Apretude, which is given as an injection. All right. The important thing to know here is although PrEP protects you against HIV, it doesn't protect you against STIs. Okay. So who should take PrEP? Well, anyone who is HIV negative and who might be at risk for getting HIV. Basically, anybody who's having unprotected sex would be a good candidate for PrEP. But again, it is not for people living with HIV. It's only for people not living with HIV. Okay, for everybody, both people living with HIV and not living with HIV, we also have this doxy-PEP, which is post-exposure prophylaxis using doxycycline. And doxycycline is an old antibiotic that's been around forever and ever and ever. And if we take 2 pills, no more than once a day, after having unprotected sex, it decreases the risk of contracting STIs. Remember, PrEP is only going to protect you against HIV. PEP is going to protect you against some of those sexually transmitted infections that we just talked about. All right. And it has to be taken within 72 hours after having unprotected sex. And it decreases your chance of getting chlamydia, syphilis, and gonorrhea. And remember earlier, we talked about all 3 of those, okay? And the effectiveness is anywhere between 60 and 80%, okay? It does not protect against HIV, very important to remember. So therefore, you have to take PrEP to protect you against HIV if you're not living with HIV. And doxy-PEP can be used for all people at risk for sexually transmitted infections. So even if you're living with HIV and you want to decrease your risk of getting a sexually transmitted infection, like wouldn't we all want to reduce that risk? Then you can talk to your healthcare provider about getting you on doxy-PEP. Okay. And this medicine's not taken every day. It's just taken after you've had unprotected sex. Okay, so what does PEP do? It keeps these STIs from going into your body, reduces the risk anywhere from 60 to 80%. And it's the only approved medication right now is doxycycline. And this medication, it's very important to note that doxy-PEP can only be taken by cisgender men and cannot be taken by cisgender women. Doxy-PEP can be taken by transgender women, however. Important thing to note, PEP does not protect you against HIV. It only protects you against the sexually transmitted infections that I talked about earlier, right? So that's not going to, Doxy-PEP is only going to protect you against chlamydia, syphilis, and gonorrhea. Okay. Who should take Doxy-PEP? Well, again, anybody who's at risk for getting an STI, anybody who's having unprotected sex, should be, thinking about talking to their healthcare provider to get on Doxy-PEP for STI prevention. All right. And again, it can be used by all people, people living with HIV, people not living with HIV, and people who don't know their HIV status. Okay. So this Doxy-PEP information might be new information for some of you. All right. How do I get it? If you click on this QR code, it will put you to the Florida Department of Health website. That's a PrEP and PEP locator that you can use. Also here at the University of Miami, we have Dr. Lewis, who's from the Department of Infectious Diseases. She sees a lot of HIV patients, and she also sees people who are on PrEP and PEP. So her phone number is there that you can call and see if you can be seen by her if you don't want to go to the Florida Department of Health. Okay, and then the last biomedical thing that we want to talk about is this thing called U equals U. Okay, and again, it's another biomedical, it's not a behavioral, and it means undetectable equals untransmittable. All right, so what we got to think about here, how does a person with HIV get to undetectable? Well, they get to undetectable by taking their HIV medications as prescribed. Most of them are once a day regimens. And there's also injections, every 2-month injection that you can get. And this gets your viral level down to what's called undetectable, right? And so when you are undetectable, that means that you cannot pass that infection to another person. Okay. So part of this is taking your medicines and seeing your healthcare provider regularly. Okay. All right. U equals U is for people living with HIV. And again, taking their medications regularly and having an undetectable viral load means that the virus can't be transmitted. HIV can't be transmitted to other people, right? So we got those three things. We got PrEP for people to prevent HIV, all right? We've got PEP for all people who want to prevent sexually transmitted infections. And then we have U equals U, which is getting your viral load down to undetectable, which means that you won't transmit the infection to other people. So we got some nice, exciting options there to prevent, the spread of HIV infection and also the spread of sexually transmitted infections. Okay, so let's summarize here. So everybody, remembers these options that we have. So thinking about these prevention methods, okay, and again, the first three are behavioral, and then the last three are biomedical. Abstinence, people at risk for HIV and people living with HIV both can use abstinence, right? Being faithful, both people at risk and both people living with HIV can be faithful. And using condoms are for people with HIV and for people at risk for HIV and people living with HIV. PrEP is only for people at risk for HIV. It's not for people living with HIV. All right. And PEP, which is our Doxy-PEP, which prevents our STIs, is useful for both people at risk and people living with HIV. U equals U is not useful for people at risk for HIV because they don't have HIV. So U equals U is not going to work for them. but it is useful for people living with HIV. All right, so we gave a lot of information here, a lot. So here we would have a group discussion about PrEP and PEP and U equals U. Okay, so we would ask, what's your opinions about PrEP to prevent HIV and PEP to prevent STIs? And we would talk about, have you heard of them? Or would you be willing to take them? Do you think you would have any problem being adherent to them? Those type of things we would talk about. And then we would also talk about U equals U as an HIV prevention method. And probably a lot of people may not have heard about U equals U and may not have heard about PEP. From the information that I'm gathering from transgender women, a lot know about PrEP. Fewer know about PEP, and a lot don't know about U equals U. So hopefully, in this session, women will get the information that they need to, help them with all of their HIV prevention options. Okay, so this is wrapping up session 2, and we would give them, the women participants, another homework assignment. And we would ask them to discuss with people in their lives their beliefs about HIV and STI prevention. And we would ask them to ask their friends, family, neighbors, their knowledge about PrEP, PEP, and U equals U. Okay. And we would ask them that, like, if people don't know, to kind of educate other people and kind of clear up misconceptions. All right. And again, we would review this homework next week in the next session. Okay. All right. So this one, there's also another homework assignment for this one. But we want to provide a disclaimer here about the homework assignment. If someone is experiencing, gender dysphoria or doesn't want to participate in this exercise, we would ask them to opt out and not listen to information on this assignment. And the same for you if you don't want to hear this information. But here, what we would ask them to do is we would like people, all right, to look at their private parts and their anus, okay, their butthole, asshole, whatever term you want to use, with a small mirror, okay? And the objective of this exercise is for you to identify what are the normal characteristics of your body, right? So what's normal about your body? And then later on, if something changes in your body, you will know that that change might be related to a sexually transmitted infection. Okay. Again, we realize that this assignment may be triggering for some people. And so not everyone has to participate in this second assignment. Okay, here at this point is when we would do the session evaluation. We would ask women to evaluate this session. All right. And here also, this would be our time for referrals. So for example, if you needed a referral of where to get PrEP, where to get PEP, or if you're living with HIV, where to get back into care with an HIV doctor, we could ask you to speak to the session facilitator privately at the end of the session, and we would be able to make those referrals. Okay. At this point, we would thank the participants for participating in session 2. And here's the point where I would thank you also for reviewing session 2. So this ends our session 2. When you have finished listening to session 2, please email me, text me, or call me. You all have my number and my email, and we will set up a time to provide to do the evaluation of session 2 by telephone. Thank you all so much for spending time of your day with me, and This ends session 2. Thank you.